welcome to Eye on You. I'm your host, Tina Hunt, and today we have a great discussion planned for you. Today is not a debate show, and I'll tell you why. When we talked about should shots be mandatory for kids, I found that there are as many people on the left that believes yes and no as there are on the right. So I thought if we debate this, it's going to be awkward. So we decided that we're just going to do a discussion today. What do you guys think about that?
Sounds
All right,
wonderful.
okay.
Yeah.
So we're going to, but I can tell you right now, I am on the fence. And I'll tell you a little story. I have two children, a boy and a girl, and they're about 4 years apart. My son went off to kindergarten, and he came home one day with chicken pox. Remember those? Mm-hmm. Okay, that's those little sores all over you that ooze, and you got to put that calamine lotion on it, and and then keep, let it air out and whatnot. Well, he got them. It was okay, but then my infant got it. So I've got a little baby that's got the chicken pox. This baby is not potty trained. Okay, so she's got chicken pox and bumps everywhere, and it was just absolutely horrible. And later on, when I found out that they had a shot for chicken pox, I began to wonder, would I have had to go through that with the baby if she would have had that shot? So as a result, I am really I'm just on the fence, guys. So this discussion today, I'm going to be listening to you guys because I want to find out if you guys can convince me one way or the other. At the end of the show, will I be for shots mandatory or against them? So, okay? All right, let me introduce the panel to you today. All right, in the middle here we have Dr. Antonio Brown. Dr. Brown is a PhD from Michigan State.
University of Michigan.
University of Michigan, okay.
Yes.
Totally different, right?
Yeah, absolutely, especially
okay.
at football.
All right, okay. All right, so, and he's taught at USC,
Yes.
UCLA, Stanford, and my school, Loyola Marymount University. Welcome, Dr. Brown.
Thank you very much.
All right. Okay, and we have Mark Fafiades, and Mark is the chairman of the LA County Republican Party.
Yes.
Awesome, Mark. Welcome.
Thank you, Tina.
Okay. We have also with us today Dr. Renee Dorr. Dr. Dorr is a podiatrist, and you listen to this, guys. And when you ask her to give you a bio, she puts on there, and I love her. I've known her. We go way back. I taught her children. She puts on there, I'm a wife and a mother of 2 boys. And I just love it. Okay, that's a priority for her. Welcome, Dr. Dorr. All right. The young lady on the end here we have with us today, Shinoye Okiki. Did I murder it? I'm okay. I'm pretty good. Pretty close.
It's okay.
Sonoye Okiki. Okay. Sonoye just graduated from San Diego State University.
Yes.
Let's hear it for Sonoye,
Thank
guys.
you.
All right.
Congratulations.
Welcome.
Thank you.
Okay. And here to my left we have Giuseppe Robalino. All right. Giuseppe is a college. Are you a senior?
I'm going to be senior,
Going to
yeah.
be a senior, all right, and he goes to USC.
Go Trojans.
Welcome, all right. All right, thank you. You know, Dr. Brown, I'm ready to get into this discussion, so I'm going to turn it over to you. Take it
Wonderful.
away. What is our question for today?
Well, today, as you kind of lean towards, we're going to ask, should vaccines be required of children?
Take it away.
Great. But before we do that, Mark, we were going to hear a little bit more about you today.
Well, my position as a Republican Party of Los Angeles County Chairman, being a volunteer position, I actually have a job in addition to that. So I actually work for a large healthcare provider as an administrator in Southern California.
Well, then we're going to start with you. Should vaccines be mandatory or not?
I think they should. That's the way I'm leaning. First of all, I'm a big fan of vaccines. So as far as vaccine or not vaccine, I say absolutely yes. As we get into the discussion, we'll talk a little bit more as far as if they should be mandatory or not. But over the years, infectious disease has killed millions and millions of people. I mean, the Spanish flu in the early 1900s, it's estimated to kill between 20 and 50 million people. Smallpox, when the Europeans came to the United States, to America in the 1600s, it's estimated that when they were exposed, the Native Americans, that possibly 70% of the population in New England of Native Americans died because of smallpox. Polio is something that we all kind of grew up with, well, at least people my age, because we saw people in leg braces that were affected by polio. These have all been eradicated because of vaccines. So therefore, I'm a big proponent of vaccinating children.
Okay. And Dr. Dorr, in your opinion, what do you believe? Should vaccines be required or not?
Now that the vaccines had eradicated polio and smallpox, we don't have to have a smallpox vaccination anymore. We don't need one. In a scientific standpoint, it proved to be reproducible. Yes, it worked. But the question now is, do we still need some of these vaccines? When you look at the con side of these vaccines, what people think and the way pharmaceuticals produce these drugs that are taken off the shelves. You know, you have a public who are scared and they want to know more. They want to know more, and they're going to do a lot of research, and there's going to be a lot of discussions and debates. So I'm for or against. I believe that there's not a one-size-fit-all approach.
You know, it really leads to a very political question. And fortunately, we've got Giuseppe here, our budding politician. Should it be required or not? It sounds as though it could be helpful, but now we have a political question around the requirement.
That is certainly a very challenging one because, as Mark has stated, you know, vaccines have eradicated a lot of diseases throughout history and has helped, you know, the human population just thrive and remain healthy. However, when you get the government involved, I think it becomes a constitutional argument. Does, for example, the California law, Senate Bill 277, does it stand up to constitutional muster? You know, is government overstepping its bounds? Yes or no? I personally believe that as the bill is written, I think it is. However, in general, I find that vaccines, you know, the negative side effects are on the tail end of this like statistical distribution.
I'm not going to let you go yet. When you say you think it is based on how the bill is written,
and
what
based
makes
on how
you
it's
think
written.
so? About
the Senate bill?
Yeah.
Yeah. Well, for example, first, you know, California had allowed exemptions for medical reasons, you know, and they allowed, you know, also for religious and philosophical beliefs, people were allowed to, you know, be exempt. Parents were allowed to make that decision. However, as time went on, then those rights went away and it became only medical decisions. Now you have SB 277, which completely takes out any religious decisions away, and it's only for medical decisions, only for medical reasons that people can opt out of it.
For instance, if you're allergic to the vaccine.
Exactly.
Yes.
So I feel that basically what has now happened is that you've slowly, from a constitutional rights standpoint, you started chipping away at parental rights.
Okay. Interesting. Well, Nonya, we're going to let you in on this too. You're not off the hook.
Well, I really am for the vaccines, especially for children, because for those who do have children, we do not want to see them suffering these diseases that can be prevented. So for the vaccines, I really believe that they should get them because I think public safety should be the first priority for the law. So when people have passed these laws saying that that children need it's mandatory for children to get vaccinations, I'm definitely for it. Just because I think when kids are at that disadvantage, and if we have the means to stop it, I think we should definitely do that. So I'm definitely for vaccinations.
You raise an interesting question when you say public safety and public concerns. We don't have, even with mandatory vaccination, if all of our young people were vaccinated, our borders are permeable. As we saw with the Ebola so-called crisis, we did see instances arise here in the United States. Vaccination won't stop that happening. The mumps can come across our borders where others have not been vaccinated. What do you have to say about that, Mark?
Well, again, if the population here in the United States is vaccinated from certain diseases, then even if people come over that aren't and that are infected with the disease, a majority of the people that have been vaccinated, inoculated, will not get that disease. So again, it will reduce the spread, whereas if there's a large swath of the population that has not been inoculated, then we'll have a crisis on our hands.
Yeah, that's kind of like the herd immunity, where the more people who are vaccinated, the less people who are not vaccinated will get the disease. Another thing we have to think about is we have a lot of traveling, a lot of airplane rides going to and from different countries. UNICEF, for example, even though we eradicated polio from our country, UNICEF actually reported that there are 500 cases worldwide. that have polio. And we're talking Pakistan, Nigeria, and Afghanistan. Now, it's a plane ride away. And that's scary, because when the people who are not vaccinated, the people on the con side, could they get this disease? So it's a scary thought.
So now, where do politics really fit into this, Giuseppe? We have to be concerned about public safety more so than I just don't feel like doing this.
This is
You know what? Because I see I'm going to have to take a break, and I know he's got good information. We want to hear all of it. Don't want to cut him off. Let us go ahead and go to break, and when we come back, we'll start with you, Giuseppe. How about that?
That sounds wonderful.
All right, we'll be
Thank
back
you.
in a moment.
Thank you.
'Cause nothing ever gonna make this world better if we don't start believing that love really, really, really is the answer. Everybody join hands, 'cause it's time now. Spread the love all over the world. Spread it all over the world.
Welcome back to Eye on You. We're having a great discussion on should vaccines be mandatory. And that was a great opening, guys. And Dr. Brown, I believe you just asked Giuseppe a question. Why don't you go ahead and ask that question again? I'll turn it back over to you.
I sure will. Thanks, Tina. Yeah, Giuseppe. So we've heard a lot about reasons to get vaccinated or not. But from a political perspective, as you said, for non-medical considerations, we're actually opening up a possibility of infectious disease spreading. So how do you respond to that?
Well, you know, in terms of law, I think that it's very important that when we're considering, politicians in Sacramento making decisions, it does come down to this very delicate balance, as you alluded to, between a public health standard as well as an individual choice standard. So, Chief Justice Roberts, I want to say this is for you. I want to see this. I want to see this taken to the Supreme Court because, there is no national law regarding and whether or not vaccines should be mandated. So, regardless of what you think of Ron Paul, he says that freedom over our personal bodies, is the most basic freedom of all. So I want to see the statistical evidence. I want to see, the doctors come out. I want to see those amicus briefs being sent to the Supreme Court. I want to see SB 277 challenged. Quite honestly, should it pass all the way? I want to see it challenged. And I want to see, is there a public health risk that far outweighs, whether it's, what they call reasonable, important, compelling, all the different Supreme Court tests that they have. Does it meet any of those standards? What standard are they going to append to it? I think the issue of where it is now deserves national scrutiny at this point.
Well, we'd like to hear from everyone on this balance between your personal and individual rights and the concerns for public safety. We'll start with you, Nonia.
Well, referring to what Giuseppe said, I know there has been some research linking the vaccination. I know a lot of people have raised the link between autism and vaccines. I know that the CDC, the Center for Disease Control and Prevention, they had did a study in 2013 to see the link between the antigens which fight and make sure that the immune system is protected, and they did not see that there was that autistic kids did not have lower antigens than those without autism. So I feel that there has been some research, and I know that we do need some more, but I feel like that people are definitely scared of vaccines, and they're asking that question, well, why should we continue to get them? It's kind of like, I'll say, going to the gym. If you go to the gym 3 months, your body's fit, your body's toned. You can't just say, okay, now I'm done. I'm done for the rest of my life. Your body, it's not going to stay the same. So I feel like with vaccinations that we have to continue doing. We don't have to get a full dose, but we have to maintain that, and that's kind of what vaccinations are doing right now. We have to maintain our immune system, because if we stop, then who knows, we may go back and history may repeat itself. So.
Well, Mark, Giuseppe's talking your language with Ron Paul and all. What's your response to the balance between individual freedoms and public safety concerns?
Yeah, I think public safety-wise, it is very important that children are vaccinated. I would be for a law, but my concerns would be a slippery slope effect. And that is, if we pass a law saying that certain immunizations are required, well, who's to say that some preferred vaccinations may be added to the list in the future that may not really be necessary? That's my concern. I think also a lot of the fear of vaccinations from some people comes from not really understanding what they are.
Yes.
And when somebody becomes ill, you go to the doctor and you get drugs. You pump yourself full of drugs or antibiotics, and sometimes the antibiotics have the reverse effect down the line in that they kind of mess up the immune system, they weaken it. An immunization, a vaccine, is put into the body. It emulates a disease so that the body strengthens the immune system to fight that disease then and in the future. So it's totally different from drugs, and that's what people need to understand.
Both of you kind of raise interesting points that allude to something I want to ask Dr. Dorr about. Because once you're vaccinated, you do have to have your booster shots. So is there a slippery slope now that says, okay, you're required to be vaccinated, and now as an adult you're required to have booster shots every so often? Where do you stand on this
Right.
balance?
I'm not sure about that booster shot. The people who are on the con side, they basically say that if they get the disease naturally, you only have to do it once. There's no boosters.
Okay.
And so the people on the con side will be arguing things like that.
Yes.
When you get the stronger naturally, you get the stronger dose, you're pretty much set.
Yeah.
Yeah.
So you're saying it's,
I guess what I'm saying is you got to look at people on the con side
yes.
because they're doing their research
Okay.
and they're worried. Everyone's worried about the preservative mercury.
Yes.
And does that have a link to autism? They have other metals in these vaccines like aluminum.
Any thoughts on how far away we are from really knowing? Is the evidence really solid linking autism and so forth?
I don't think it's solid. I think it needs more study.
Yes.
But we have to be careful with the mercury and the aluminum, and the things that we put in as a preservative. And I know they took them out.
Yeah.
But I think further investigation is needed.
Oh wow. So
Yes.
this
Yeah.
makes it even more
Yes, it
difficult
does.
for you.
Yes. So Supreme Court Justice Roberts, please take it away once more. Really, all the justices, but this is the type of information that needs to be presented again to the justices, because as Mark actually stated earlier, a lot of what it is lack of lack of information as to what these vaccines are and how they work, right?
Yeah.
So in the legal history of this legal history spans years into the past, and so before in California at least, when parents did have the choice as to whether or not they're going to vaccinate their children, one of the vaccines recommended to go into school, whatnot. They had to be educated by a doctor. They had to meet with a doctor, and the doctor would give them the information about the vaccine, what's in it, and stuff like that. And then they would make an educated decision. That right has now been taken away. And that's potentially problematic because, as Dr. Dorr pointed out, some parents can have legitimate concerns as to what's in them. And I think that right still belongs with the parents.
To the individual.
Yeah.
Well, full disclosure, I had all my shots and all my boosters, and I never had a childhood disease. So I'm not saying for or against. I'm just saying what worked for me. But where do you stand? What do you think, Mark, especially in response to Giuseppe's last point?
Well, one thing we've mentioned a couple of times, and that's the possible link between vaccines and autism. Where this came from is there was a study in 1998 by Dr. Wakefield, which was totally debunked. He basically studied not 1,000 children, 5,000, 10,000, 12 children. He studied 12 children. It was later found out that he had manipulated the data because he was basically hired by an attorney firm that was looking to sue vaccine companies in the future. He was paid over $600,000 to do this. But of the 12 children, it was found later that, again, the data was manipulated. Of those 12, 5 had symptoms before they were vaccinated. 3 never had autism at all. So it was totally debunked. It was called an elaborate fraud. And one of the bad results of that is that there are people now that don't want to get vaccinated because they think that's happened. Also, it's diverted attention away from finding the true cure of autism because they think, oh, we found the cure, it was because of vaccines. So that's a shame.
Yeah, education seems to always be the bottom line of so many of our questions. Nonye, where do you stand? Has any of this changed your mind?
Well, I know I was doing some research on the link between the autism and vaccination, and the CDC does have a mercury-free alternative. So for those who are concerned about mercury, and they can get that alternative as well. So I did do my research on that, and I feel like that is a good way to show that I don't think the mercury is really causing it, because they did see that when they did the study, they saw that those with the thimerosal, I think that's what it's called, those who got the vaccine later on, they saw that the kids did not have autism as well. So I think there's so many different variables. So we really have to do an extensive research study on autism, because there's so many variables that may cause autism, you know. Environment, the mother's diet. So we have to look at those as well, instead of just looking at just one thing.
And Dr. Dorr,
I am so sorry, Dr. Brown. We need to go to another break.
Okay.
This is great information. I am still on the fence. Okay. All right. So we'll be back in a moment.
Thank you.
A little voice came on the phone and said, Daddy, when you come home. He said the first thing that came to his mind, I'm already there. I'm already there. Take a look around. Oh, I'm already there.
Being there. Pass it on.
Welcome back to Eye on You. I'm your host, Tina Hunt, and we're having a great discussion today on vaccines. Dr. Brown, take it away.
Oh, yes. Well, I wanted to turn to Dr. Dorr, and we've heard quite a bit, but I wanted to hear a little bit more on the con side from you.
Yes, a lot of people are on the con side, and they're bringing up some very interesting points. One of the points they're bringing up is when you have the chicken pox or the German measles or measles in general, all it is a rash and a fever, and they take care of it. You know, you take your lotion, as Tina said, and you take your medicine, and everything's fine, and you get great immunity from that. And another thing they are concerned about is some of these, there's one drug in particular, retrovirus. It was a vaccine, and basically what happened was it was pulled from the market 9 months after it was on the market. And that's a really strong concern with parents. Well, what if the vaccine that their child's getting will be pulled eventually from the market? I mean, it's a scary thought. So there's a lot of scary things going on out there that parents are genuinely concerned about.
So there are some serious medical concerns, as it sounds like Giuseppe has exceptions, but you had some other thoughts.
I certainly think so, that there are very serious medical concerns regarding this, and I think that that's what makes the case for individual choice so strong. I mean, if we do look at some of the considerations, I don't know exactly what my opinion is on them yet, but certain considerations are, for example, that the court could examine things like both the Children's Hospital in Philadelphia as well as the Mayo Clinic. Both have gone on the record stating that actually natural infection is still a better way to, build immunity, despite the vaccines. On the other hand, vaccines are still one of the safest medical products out there, actually, statistically speaking. So, these are two things that you have to weigh. And as Dr. Dorr was alluding to, chickenpox, measles, rubella, all these really inconveniences can be treated now with over-the-counter medicine. So these are the things that have to be entering into the conversation, into the political discourse, and to really taking it back to, do we want to make this a requirement or not?
That's a real eye-opener for me. I never really thought about it as really an inconvenience. It's not life-threatening diseases we're talking about here. What do you think, Mark? Well,
that addresses my concerns that I mentioned earlier, the slippery slope concerns in making something mandatory. I think if something is life-threatening, if there are diseases out there and there are vaccines that will stop diseases that kill people, those are the kinds that should be mandatory. But for something that is only, as you mentioned, Dr. Dorr, like a rash, then it should possibly be optional. There's no reason to keep adding more and more and more because we think it's a good idea rather than it's life-threatening to the population.
That's a good point. Yes.
Yeah, and from what Dr. Dorr said with the individual choices, I feel that we have to make that individual choice in asking more questions. When we go to the doctor, just don't let the doctor put whatever they want into you. We have to ask more questions. And I feel like when we go to the doctor now, we don't get really intimate with our doctor. It's kind of like a 10-minute thing and then who's next, and I feel like we have to really sit there and, demand more questions and demand more information about what's going on there so the whole public knows more about, and I feel like that's a next step that we should be taking.
Yes.
And another thing, when you go to the doctor, like you said, you only get your 10 minutes. Well, doctors are saying now that if your child is not vaccinated, I don't want to be your doctor. Well, you don't want to send your patient to a charlatan and have them have misguided information.
Exactly.
So you have to be careful in that aspect too. I don't think that doctors should throw away their patients because they're unvaccinated.
That's what they're there for, to help us. So.
Yeah, it is important that the doctors really, rather than do that kind of behavior, that they actually educate as far as what the benefits are of getting your child vaccinated.
So the doctor-patient relationship, education around the vaccines and what they're there for, and also really this important point that we're really not talking about life-threatening diseases in this day and age when we deal with these vaccines. Those are all very interesting points. So what's going to be your vote when this comes up?
Well, I'm going to vote on the side of individual choice. I think that the laws in California already stand, for, previous to this point, just the requirement that parents speak with a doctor before they do it. And I think that, from a legal standpoint, the Supreme Court has enshrined the religious exception. So California has is doing away with that with this law, and I think that's problematic.
And your counterpart here, what do you say?
Well, I'm still definitely for vaccinations. I think there are some risks, like a lot of things out there, but I feel the opportunities and the benefits heavily outweigh those risks.
Mark?
I'm also leaning towards making a mandatory law, and I'm usually not for making mandatory laws. However, again, as long as there are safeguards in there, as long as they don't expand the list and they only really make it for life-threatening diseases, I don't think actually there should be an exception for beliefs, because then someone could say, it's my religion, I don't believe it, and then 50% of the people won't get vaccinated. So unfortunately, in this case, I don't think that should be an exception.
Fortunately, I get to remain neutral here. I don't have to make a choice. And I don't think we're going to put Dr. Dorr on the spot either, Tina.
I like what Mark said, because I think most of the kids would say, I'm religious. I don't want it because it hurts. Listen, that's all the time we have for today. Thank you for joining us, and we will see you next time right here on Eye on You.
Nothing ever gonna make this world better if we don't start believing that love really, really, really is the answer. Everybody join hands, 'cause it's time now. Spread the love all over the world. Spread it all over the world.
I'm not what the girls here would call classically good looking. I spent most of my youth in the dreaded friend zone. That all changed when my folks got Charter TV. I discovered tons of chick flicks in HD and on demand, and learned all the secrets to romancing the high school girl. Now in a school full of boys, I'm the man. I'm the man.
Get Charter TV starting at $29.99 per month. Charter, make way for more.
Hi.